about the services that they provide at the Atlanta Fibroid Center. I am so honored to present Dr. Lipman.
Thank you very much. Thank you, Dr. Marsh. Thank you, Alicia Guyton, and the members of Under Black Women Metro Chapter for having me come out. Dr. Marsh knows that I'll speak to anybody that'll listen, because we have what I think is a very, very important message, and that's simple. If you're struggling with fibroids, you don't have to have hysterectomy. And we'll get back to that in a moment, but I am Dr. John Lipman. I'm the founder and medical director of the Atlanta Fibroid Center. I've been a practicing physician here in Atlanta for the past 31 years. I guess I should start out with a question. Who knows what a fibroid is? Anyone? In the back. What is a fibroid? Anybody? Fibroids are benign tumors that reside in the uterus. In fact, it's the most common pelvic tumor that we see. 1 of every 3 women have these benign tumors, and up to what percent in African American women? 10%, 30%, 50%, 80%. 80%, that's right. 80% of African American women have these benign tumors. It's the most common reason why women have heavy periods. That's why you'll need those sanitary products over here. The #1 reason, fibroids. It's also the #1 reason why women undergo hysterectomy in this country, which I'm here to tell you is absolutely unnecessary. Hysterectomy is the 2nd most common surgery performed in the United States. Why? Why are we doing that? There are a lot of reasons, some of which are kind of difficult subjects to talk about. A white male physician spoke at Tuskegee University to a group of several hundred young black women about the Tuskegee experiment. I was pretty nervous, to say the least, but they reassured me it's not the messenger, it's the message. The message is you don't need to have hysterectomy. We perform an outpatient, non-surgical procedure called UFE. We have brochures over at the table, you can read about it. Uterine Fibroid Embolization, UFE. Patients of mine go home the same day with a Band-Aid and their uterus. I met 3 women after the talk at Tuskegee, less than age 30, that had already had a hysterectomy. I have daughters that age, that's tragic. None of them wanted it, but they were only given one option, hysterectomy, and they were suffering, as a lot of women who have fibroids do, and eventually they just gave up and had the hysterectomy. And I want to put a stop to that. The average age for hysterectomy in this country is less than 40. What are young women that are suffering with fibroids that end up getting hysterectomy? Hysterectomy should be for cancer. That's totally appropriate, not for benign disease. UFE is one of the biggest medical breakthroughs for women, but you won't hear about it because the gatekeepers of women's health are gynecologists, and gynecologists are surgeons. And when have you ever seen a surgeon that doesn't like to cut on people? You won't. You see it in all the shows, you know, the surgical medical shows. They love to operate. And it's great for cancer, and it's great for some other things if you need to be operated on, but for fibroids you don't. And because fibroids are so prevalent, that's why we do a lot of hysterectomies in this country, and it should stop. I'll hear a lot of times that from patients telling me their gynecologist says, you know, they told me I had to get a hysterectomy because I'm done having my children, or I'm not interested in having children, and I no longer need my uterus anymore. That's ridiculous. Absolutely ridiculous. There are consequences to losing one's uterus. To psychologically, like a man being castrated. In fact, I speak at medical meetings about this, and I had a woman come up to me recently and said, you know, you were absolutely right about the stuff you talked about, UFE and hysterectomy, and if it were men that were suffering with these benign tumors, you can be absolutely sure that we wouldn't be getting castration and cutting off testicles if it were a man's condition. We're doing this because it's a woman. Hard to argue. We've been doing it for so long, no one is questioning it. We're in the Southeast. How many people remember hearing about Mississippi appendectomies? Fannie Lou Hamer. All these unnecessary surgeries performed on young black women. It's got to stop. How do I know if I have a fibroid? Well, it's the #1 cause of heavy periods. Sometimes women bleed so heavily with fibroids, they don't realize what abnormal is. Just because you've been bleeding for a long time doesn't make it normal. You should be changing pads no more frequently than every 3 or 4 hours. Not 2 at a time, not every hour, not having episodes of blood run down your legs, not paying water. I hear about these things every single day at the Atlanta Fibroid Center. My periods are outrageous. I have crime scene-like periods. The fibroids can cause a lot of misery. It can push on things. It can cause pelvic pain. It can cause sciatica. We've had patients that have had a workup with their back doctor. Can't find anything. The sciatica is because he has this big rock-like fibroid pressing on the pelvic nerve to give you that sciatica. It can be in the front of the uterus and press on the bladder to cause urinary frequency. Women can pass their husbands in the night. He's got prostate conditions, she's got fibroids, and they keep going back and forth to the bathroom and pass each other like two ships in the night. Fibroids are pushing on the bladder, not allowing the bladder to fill appropriately, so they go more commonly. So heavy periods, pelvic pain, urinary frequency, bleeding abnormally, these things should trigger a visit to your doctor. Find out if it's fibroids. Now if it is fibroids, it's something we can help with. But you gotta know to ask. You gotta know about this information because gynecologists, for the most part, and there are studies showing this, for the most part won't mention UFE to you at all. UFE, again, is one of the biggest breakthroughs. It takes me about 30 to 40 minutes to perform. It's outpatient. Each uterine artery, there's one on each side, and we can direct a little tiny catheter like a piece of spaghetti into each of those uterine arteries one at a time. They each branch like a tree, getting smaller and smaller branches till you get out to the leaves. The leaves of the tree, and I know what size they are, and I can plug them up. So the uterus stays alive, but all the fibroids die, every last one of them. And when they die, they start to soften and they start to shrink, and a woman's symptoms go away completely. So it's a 30-40 minute procedure, several hours of recovery, and they leave with a Band-Aid. That's it, a Band-Aid. No surgery, no general anesthesia, no cutting on you. Keep all your parts. We've had numerous children born after UFE. I've had multiple sets of twins. Our births are typically full-term and vaginal. If you get a myomectomy, a surgical option to cut out some of the fibroids, and if you happen to get pregnant after a myomectomy, you will get more surgery. They won't let you have a vaginal birth. You'll get a C-section, automatic. Again, another difference. So in summary, I just want to say, look us up, because this is information you might not hear otherwise. Our website is atlii.com, ATL for Atlanta Interventional Institute, that's our parent company, atlii.com. We have a YouTube channel, the Atlanta Fibroid Center, with over 150 videos on UFE, on fibroids, on the symptoms, what we treat. Instagram, dr_ my last name, dr_ Lipman. Very easy. So I hope this brief talk has been helpful, information you might not hear otherwise. And I'm happy to answer any brief questions you might have now, or if it's an embarrassing topic, sometimes people don't want to ask questions. Certainly our booth is right over here.
Any questions for the great Dr. Lipman from the I want to compare what are the side effects once a woman is unnecessarily gone through a hysterectomy. What could she go through? And then compare that to what you go through after you get the uterine embolization procedure.
Great question. So while the surgeon, the gynecologist, will tell you about the complications from surgery, which are many, a lot of times there's transfusion, that's a bloody operation, so a lot of women are transfused intraoperatively. They can cut accidentally important structures in the pelvis, nick the ureter, nick the bladder, nick the bowel. Lots of adhesions and scar tissue from operating in the pelvis. But they won't tell you what happens to you as a woman when you lose your uterus. They don't talk about that. They'll just talk about the surgical complications. There are many things that happen. That's why I say when I hear that, oh, my gynecologist told me I'm done having my kids, I don't need my uterus anymore, that gives me the chills, because there are a lot of women that struggle psychologically. You had a mental health discussion. Well, women that have had hysterectomies, there's a number of them that go into this like postpartum depression, losing the womb, the epicenter, what makes them a woman, and they've lost it. And when they find out it was lost unnecessarily, that's tragic, causes hysterectomy. And people don't want to talk about it because it's embarrassing, but it's real. You can Google it yourself, but loss of libido, loss of orgasm. Go into any Publix, Kroger, CVS, Walgreens drugstore that sells adult diapers. I'm going to give you a homework assignment. Go to the adult diaper aisle, and you'll see the packaging. Depends is the largest one. And who's on the cover of that adult diaper package? What I think should be, and what I expected to see when I look at the package, I'm expecting to see my parents. My dad is 95 and my mom is 93. That's who I think should be wearing adult diapers. You won't see my parents, guaranteed. What you will see is someone that looks like you. Young, attractive, black woman. That's who's on the package. Why? Because that's their target. Average age in this country of hysterectomy is 39. You'll see young 35 to 40-year-old attractive black women on the diaper. We're like, what the hell? Unnecessary, totally. In fact, I have an advertisement in my office. It's from Depends. It's a woman with a diaper on, an adult diaper, and she's got her skinny jeans, and she's doing one of these numbers, a little scooching up, and they said something cute like, "You'll never know what you're wearing." What? They'll never know? What the hell? Why do you need a diaper? I want to know that question.
Yeah.
That's what I want answered.
Yeah.
Not like they'll never know, like crazy.
For Dr. Lipman, we have a question.
I'll come to you. Absolutely different. Laparoscopy involves surgery. There's two types of surgery. There is open surgery, where they literally cut you open like a C-section horizontally, or if your uterus is so big it goes above your belly button, and we see a lot of those ladies, they can't do a horizontal because they can't get the skin pulled up enough to get that uterus out this way. They'll cut them vertically, breastbone to hairline. And sometimes they go, oh, well, we'll try to do it horizontally, and then they cut her this way, and then they end up cutting her this way. Now it's an upside-down T. That's horrible. I mean, any of this that's open surgery. And then there's laparoscopic surgery. Now, laparoscopic surgery is still surgery, general anesthesia, all that, but instead of a long incision, open, they are several shorter incisions. It allows you to heal quicker. Through those short incisions, they'll put these metal straws into the incision and blow the belly up with carbon dioxide, and now they can operate through those metal straws. Two types of laparoscopic surgery. If a human is holding the instruments and operating through those metal straws, that is traditional laparoscopic surgery. If robotic arms are holding those instruments and the surgeon's across the other side of the room looking at a three-dimensional video game and manipulating those arms, That's robotic surgery, robotic laparoscopic surgery. UFE is no surgery. Band-Aid, that's it, Band-Aid. No surgery, no general anesthesia, outpatient. Keep all your stuff. And so it's in bone loss, that's the last one after post-hysterectomy. We know there's significant bone loss, and we're a lot more active than our parents' generation. We saw that woman who was 69. Did you see her?
Right.
Did you see how she moved? Yeah, that's how we need to be moving. But you're an old woman when you lose your uterus.
That's right, and you do not have to lose your uterus. Thank you, Dr. John Lipman, for this
Pleasure.